Now, Dr. Joe, of course, he is the director of the sports medicine at Akron Children's Hospital. And this morning we were going to be talking to you about knee injuries. Now, of course, the big story was OBJ out for the rest of the season because he has a torn ACL, I think.
Right.
But I guess that's a pretty common sports injury.
Yeah, we talked with Ray about ACLs quite a bit. There's new things going on and new treatments. I think a couple of weeks ago we talked about some new treatments. And literally every weekend or week that goes by, watching our major league and college players, you can see ACLs. So I wasn't going to talk specifically about ACLs this morning other than to mention it. I know you've been a mainstay, Gene, at WAKR for a long time. I was going to talk about one of the mainstays of pediatric sports medicine, one of the injuries that's a classic that we haven't talked about in a long time with Ray, and it occurs mainly in younger athletes. So you're not going to see this in OBJ with an ACL or Nick Chubb with an MCL, all these different lettered name diagnoses. This injury is called Osgood-Schlatter's disease. Some people call it OS to shorten it, likely to use other things. But Osgood-Schlatter's disease is something that is, oh my gosh, you hear parents talking in the stands and things and people talking about Osgood-Schlatter's with their kids quite a bit. I even remember when I played, there would be different guys I'd play against. They'd say, oh, that guy's limping around and knees hurting a lot. And that young kid must have Osgood-Schlatter's disease. So I wanted to just take a moment to explain this very common problem that would only occur in younger kids. We would not see it in the pros and the stars and the World Series last night or anything like that. Osgood-Schlatter's is a swollen, painful bump below the kneecap in kids that are playing a lot of sport. And partly because there's a bump and some redness to it, it is a little bit concerning to parents and even athletes sometimes. And then it gets to the point where when you touch it or bump it or kneel on it, it's extremely painful. And so parents do get distraught about this injury known as Osgood-Schlatter's disease. So at first it'll hurt kids only when they're playing and running around and playing sport pretty regularly. But then it gets to the point where even walking around in daily activities. And so kids come into my office and maybe they're sent in by parents and coaches who want to know what's going on. And they say, can we play? I want to play through this thing. The treatment is not a surgical problem. But on the other hand, if kids play, they can make it worse. And so from the standpoint of just a simple test in our office is we have them walk in the hallway, get on the treadmill and run, go on a stair step where they step up or even jump. And they can't do those things. They can't run on a treadmill. They can't jump. How can you play sports? So for many of these kids, they get to the point they're in pain doing any sport-related activity and even daily activities. And at that point, really, it's pretty clear-cut the treatment is rest. They don't want to hear that, but rest is really important. So kids are always asking me, can I get in a brace? And braces help a little, and icing certainly helps a little. And a lot of people will give their kids a lot of medicine, ibuprofen and Aleve and stuff. That helps a little. But what kids really need is they need rest. And because the muscles around this growth plate have gotten so weak, they need rehab or physical therapy. So typically 12 to 16 years of age, it peaks at about 14. It's a big bump. It's a painful area in the knee. It's very, very common in kids playing a lot of sport, and it's known as Osgood-Schlatter's disease.
How long does it usually take for them to recover from that and then get back to playing?
That's a great question. And that it's totally dependent on how quickly, how much that they'll rest it. So if we catch it early on when it's just bothering them a little bit to play, then maybe icing and stretching and home exercises can control it. But when they get to the point that it's hurting every day moving around, there are kids who come to tell me with Osgood-Schlatter's, Gene, 6 months, 9 months I've had this, 12 months of Osgood-Schlatter's. So it's very variable depending on how quickly, hey, let's do something about it early on and you won't miss a lot of time. Or we wait too long and then they get into the issues of weakness and other things and they might miss months of time.
Oh, okay. Well, it's good to know, and we appreciate you being on with us.